Would like to hear from you, each of you now, on the aspect of affordability as it relates to health care. Ms. Bird, you talked about the health insurance affordability tax credits. You talked about restoring Medicaid cuts. You've also talked about restoring Medicaid cuts. Beyond that, how do we make health insurance more affordable for people in Colorado, Ms. Bird?
It begins by making sure everybody is covered, and that's part of why those cuts to Medicaid through the budget that was passed need to be reversed. Beyond that, though, long term, we need a public option, which I support. That will offer an opportunity for another competitive source for health insurance. Public option is key, and also long term, we need to move our country away from a fee-for-service model of paying for health care. It's very expensive, and it doesn't look. That type of fee-for-service model doesn't put the healthcare system looking at the overall health of a person. Instead, compensation to providers, whether doctors, hospitals, should incentivize healthy outcomes. That needs to happen, and it's something I'm very excited to work on as a member of Congress.
Ms. Bird, thank you. Mr. Rutinel, other than what you've already talked about in terms of restoring cuts to Medicaid, how do we make health care more affordable in America?
Yeah, the issue of health care is deeply important to the people of this district. About a third of folks are on Medicaid. If you go on the Colorado Health website, you'll see that health insurance rates are doubling, tripling, quadrupling for families that can barely make ends meet as it is. I think there's many different things that we can do to cut the cost of health care. One is, we can allow Medicare to be able to negotiate prescription drug prices, which will not just lower the costs for the Medicare recipients, but also save hundreds of billions of dollars in taxpayer funds. I think we also need to make sure that we push forward for a public option that allows for a public entity to compete alongside private insurance companies. I also think that we need to have caps on prescription drug costs. That's something that we do here in Colorado. I think we can extend that. I think that folks who are on insulin, for instance, shouldn't be having to decide between putting food on the table or paying for important medical needs. And so that's the sort of three policies that I think we can be pushing for.
Mr. Rutinel, one thing that I didn't hear you mention on health care is a universal single-payer health system. You said earlier in this campaign that you support a universal single-payer health system. Is that still your position?
Look, I grew up on Medicaid, and so I know how important it is for us to be able to have affordable, accessible health care. I think that we need to be pushing for a public option, and we also need to be restoring the cuts to Medicaid and the Affordable Care Act that Donald Trump has inflicted on the people of this district. We need to
with respect, sir, that's a lot of words, and none of them are an answer to the question. You said earlier in this campaign you support a universal single-payer health system. Is that still your position?
We need to be looking for actionable solutions, and right now, Donald Trump and Gabe Evans have cut Medicaid and the Affordable Care Act. We need someone who will fight back, restore those programs, as well as push for programs that have...
Mr. Rutinel, with respect, what should voters discern from the fact that you won't answer a question about your own position earlier in this campaign? You said you supported universal single payer. Do you still support that?
Like I said, we need actionable solutions to the issues that Donald Trump and Gabe Evans have
if you're going to refuse
created.
to answer, we'll move on.